So all the medical workers here are taking a knee for 8 minutes and 46 seconds, the amount of time that George Floyd was pressed down by the police officer with his knee on his neck.
Healthcare workers in New York City have been on the front lines of the battle against COVID-19 for months. Now some of those same workers are joining protesters in the streets, despite the pandemic.
We are healers attempting to heal from coronavirus. We know we cannot heal while watching the devaluing and the dehumanization of Black lives. We cannot heal from watching Black and brown communities disproportionately die from COVID-19 while letting things stay the same.
What are the connections that you see between what happened in the hospital during COVID and what people are protesting about on the streets now?
I think people are tired of living in a place where certain people aren't valued based on their race. As a woman of color practicing medicine, it's been very hard, putting my own life on the line and risking my life to serve and to try to treat patients, and then going home and turning on the TV and seeing incidents that show that this country doesn't value Black lives and doesn't feel like Black lives matter.
Our status as healthcare workers, heroes as we've been called the last few months, does not protect us from police violence when our skin is brown.
George Floyd's death ignited the protests, but the coronavirus pandemic has put other long-standing racial disparities into sharp relief. Black Americans have the highest mortality rate from COVID-19. National data is incomplete, but so far, the numbers show that Black Americans are more than twice as likely to die from the virus as white Americans.
We knew the story back in March and April. Communities of color, immigrant communities, poor communities, these are the communities that are suffering the most from COVID-19. And we should have been protesting this then. That was also Black death. That was also murder, but at the hands of the federal government. The difference is this is a murder caught on a video by a group of people of one officer against one Black person. And that's so much more tangible. People can really latch onto that.
Do you think racism is a public health crisis?
Of course, racism is a public health crisis. These communities aren't just randomly selected by COVID-19 to have higher mortality. It's because of high blood pressure, diabetes, various comorbidities that these communities are sicker. And until we address racism as a public health issue, these communities will continue to suffer.
Sandra Bland! Sandra Bland! Breonna Taylor! Breonna Taylor! George Floyd! George Floyd! George Floyd! George Floyd! When we want justice! When we want it now!
Public health experts are worried that these protests and the police response could lead to an increase in COVID cases. Protesters say staying home isn't an option.
So as a doctor, a lot of people say, gosh, Stephen, aren't you worried about the effect of COVID at these protests? And of course I'm worried about that. But to choose between them is a completely false dichotomy. Like, both are caused by severe injustice.
So what do you think is the way forward now for the country?
A lot has to happen in the healthcare system that I work in. And the first step is that we have to stop dying in the streets. Our lives have to be worth something in order for us then to have conversations about healthcare and education and commerce and other systems from which we're routinely disenfranchised.
No more!